Amlodipine side effects, the 12 essential things. Every American over 60 needs to know. Right now, heart medication. That's a phrase no one wants to hear from their doctor, but here's the reality. If you're over 60 in America, there's a good chance you're already taking one. My neighbor Sarah had been on blood pressure medication for years. She thought the swelling in her ankles was just from getting older. My brother-in-law dismissed his constant fatigue as stress from retirement. My longtime friend Margaret kept telling her doctor about the strange metallic taste in her mouth, but no one connected it to her heart pills. I can go on, and I'm sure you can too. Living in America, if you're over 60, you have a 45% lifetime rate of developing high blood pressure requiring medication. That's nearly 1 in 2 people in your age group. But here's the encouraging news. When managed properly, blood pressure medications like amlodipine can reduce your risk of heart attack by up to 64% and stroke by 42%. Before I share these life-saving tips with you, please hit that subscribe button and ring that notification bell. This information could literally save your life or the life of someone you love. Don't let this critical health knowledge get buried in your feed. Number 1. Severe cardiovascular effects. It's absolutely critical that you understand this paradox. The very medication designed to protect your heart can sometimes make your heart problems worse, especially when you first start taking it. Amlodipine works by relaxing your blood vessels, but here's what most doctors don't explain clearly. This relaxation doesn't happen evenly throughout your body. In some patients, particularly those with existing coronary artery disease, the medication can actually redirect blood flow away from areas of your heart that need it most. This phenomenon, called coronary steal syndrome, occurs when healthy arteries dilate more than diseased ones. I used to think all heart medications were automatically safe for your heart. That changed when my cardiologist explained how my chest pain actually got worse during my first week on amlodipine. He told me this happens because the medication can cause such a dramatic drop in blood pressure that your heart doesn't get enough blood flow. The convenience of taking one simple pill a day is just not worth the risk if you're experiencing increased chest pain, severe dizziness, or fainting spells. This is why your doctor should monitor you especially closely during the first few weeks. Number 2. Angioedema, the silent killer. Have you heard about the allergic reaction that can kill you within hours, yet most people have never heard its name? Angioedema is different from typical allergic reactions because it affects the deeper layers of your skin and mucous membranes. Unlike surface hives that you can see and feel, angioedema attacks your face, lips, tongue, and most dangerously, your throat and airways. The swelling can be so rapid and severe that it blocks your ability to breathe. My doctor once told me about a patient who woke up one morning after taking amlodipine for 6 months and couldn't open her eyes because her eyelids were so swollen. By the time she got to the emergency room, her tongue had swollen so much she could barely speak. This wasn't her first dose. She'd been taking the same medication successfully for months. The terrifying truth is that angioedema can strike at any time, even after years of safe use. Your body can suddenly decide that this medication is a threat and launch a full-scale immune attack. The swelling typically feels firm and woody, not soft like normal swelling, and it's usually asymmetrical, affecting one side more than the other. Number 3. Hepatotoxicity, your liver under attack. Did you know that amlodipine can destroy your liver cells within just 1 week of starting treatment? Your liver is your body's detoxification center, processing everything you eat, drink, and take as medication. When amlodipine is metabolized, it can create reactive compounds that literally poison your liver cells. The damage happens at the cellular level, where these toxic byproducts interfere with normal liver function and can cause massive cell death. I once read about a case where a patient developed severe liver damage after just 7 days on amlodipine. She started experiencing fatigue that she initially attributed to stress, then nausea that she thought was from something she ate. By the time she noticed the yellowing of her skin and eyes, a condition called jaundice, her liver enzymes were more than 10 times higher than normal levels. The reality is that liver damage from medications can be silent until it's severe. Your liver doesn't have pain receptors, so you won't feel it being damaged. By the time symptoms appear, fatigue, nausea, abdominal pain, dark urine, and yellowing skin, significant damage may have already occurred. Number 4. Extrapyramidal symptoms. When your body betrays you. It's absolutely shocking that a blood pressure medication can cause the same movement disorders typically seen in psychiatric patients taking antipsychotic drugs. Extrapyramidal symptoms involve the part of your nervous system that controls involuntary movements. When amlodipine interferes with these neural pathways, your body can begin moving in ways you cannot control. This includes dystonia, sustained muscle contractions that cause twisting, repetitive movements, or abnormal postures that can be both painful and embarrassing. My friend's mother started experiencing what she called neck spasms that would cause her head to twist involuntarily to one side. She also developed hand tremors that made it impossible for her to write checks or hold a coffee cup steady. The most frightening episodes were when her eyes would roll upward uncontrollably, a condition called oculogeric crisis. These symptoms can be devastating because they affect your basic ability to function. Imagine trying to have a conversation when your neck keeps twisting, or attempting to eat when your hands are shaking uncontrollably. The social isolation and embarrassment can be as debilitating as the physical symptoms themselves. Number 5. Peripheral neuropathy. Losing touch with reality. Have you ever wondered what it would be like to lose feeling in your hands and feet while experiencing constant burning pain? Peripheral neuropathy from amlodipine affects the nerves that carry signals between your brain and the rest of your body. The damage typically starts in your longest nerves first, those reaching your fingers and toes. What begins as subtle tingling can progress to complete numbness, making simple tasks like buttoning a shirt or feeling the ground beneath your feet nearly impossible. I used to take feeling in my hands for granted until I heard about patients who couldn't tell if they were holding something too hot or too cold. One woman told me she burned herself repeatedly because she couldn't feel the temperature of objects she was handling. Another patient fell frequently because he couldn't sense where his feet were in relation to the ground. The burning pain that accompanies this numbness is particularly cruel. Patients describe it as feeling like their hands and feet are constantly on fire, or like they're being stabbed with needles. This pain can be so severe that it interferes with sleep, making the condition even more debilitating. Number 6. Severe psychological effects. The mind under siege. Did you know that your blood pressure medication could be causing panic attacks so severe that you think you're dying? The connection between amlodipine and psychological symptoms is often overlooked because most people don't expect a heart medication to affect their mental health. Yet the calcium channels that amlodipine blocks aren't just in your blood vessels, they're also in your brain, where they play crucial roles in neurotransmitter regulation and mood stability. My neighbor started experiencing panic attacks about 3 months after starting amlodipine. She described them as waves of terror that would wash over her without warning, accompanied by a racing heart, sweating, and an overwhelming sense that something terrible was about to happen. She became afraid to leave her house, thinking she was developing agoraphobia. The depression that can accompany amlodipine use is particularly insidious because it often doesn't respond well to traditional antidepressant treatments while you're still taking the medication. Patients report feeling hopeless, losing interest in activities they once enjoyed, and experiencing thoughts of self-harm that seem to come from nowhere. Number 7. Gingival hyperplasia. When your gums take over. It's absolutely critical that you understand how amlodipine can literally change the structure of your mouth in ways that affect both your appearance and your ability to eat. Gingival hyperplasia occurs when your gum tissue begins growing abnormally, potentially covering portions of your teeth and creating both functional and cosmetic problems. This happens because amlodipine interferes with calcium metabolism in your gum tissues, disrupting the normal balance between collagen production and breakdown. I once saw photos of a patient whose gums had grown so much that they covered half of his teeth, making it nearly impossible for him to clean his mouth properly or chew food normally. The overgrown tissue had a firm, fibrous texture that was completely different from healthy gum tissue, and it was pale pink rather than the normal healthy pink color. The condition typically starts subtly, with slight thickening of the gum tissue between your teeth, where plaque tends to accumulate. As it progresses, the gums become increasingly enlarged and firm, making effective brushing and flossing extremely challenging. This creates a vicious cycle where poor oral hygiene accelerates the condition. Number 8. Skin reactions, from mild to life-threatening. Have you heard about the skin reaction that can literally cause your skin to peel off in sheets, potentially killing you? While most amlodipine-related skin reactions are mild, the medication can trigger Stevens-Johnson syndrome and toxic epidermal necrolysis, conditions where your skin essentially dies and separates from the underlying tissue. These are true medical emergencies that require immediate hospitalization in specialized burn units. My dermatologist once described a case where a patient developed what started as a simple rash on her chest. Within 48 hours, the rash had spread across her entire body, and her skin began blistering and peeling off in large sheets. She required weeks of intensive care treatment to survive. Even the more common maculopapular rash, flat red spots combined with raised bumps, can be extremely uncomfortable and psychologically distressing. The rash is typically widespread, affecting the trunk, arms, and legs, and can be intensely itchy or cause a burning sensation that makes sleep nearly impossible. Number 9. Taste disturbances, when food becomes the enemy. Did you know that amlodipine can completely steal your ability to taste, turning every meal into a flavorless experience that can lead to dangerous weight loss? Dysgeusia, the medical term for taste disturbances, can manifest as a complete loss of taste, a constant metallic taste, or a situation where all foods taste bitter or unpleasant. This happens because amlodipine can interfere with the calcium channels in your taste receptor cells, disrupting the normal process of taste perception. I used to think losing your sense of taste would be just an inconvenience until I learned about patients who stopped eating because food became so unpalatable. One elderly patient lost 30 pounds in 3 months because everything tasted like metal. Another couldn't detect when food had spoiled, leading to multiple cases of food poisoning. The psychological impact of losing your sense of taste is profound. Food is tied to memory, culture, and social interaction. When patients can no longer enjoy family meals or their favorite foods, they often become socially isolated and depressed, creating a cascade of health problems beyond the original taste issue. Number 10. Flushing, more than just embarrassment. It's absolutely crucial to understand that the facial flushing from amlodipine isn't just cosmetic. It's a visible sign of what the medication is doing to blood vessels throughout your entire body. The flushing occurs because amlodipine blocks calcium channels in vascular smooth muscle, causing widespread vasodilation. While this helps lower blood pressure, it also means that blood vessels in your face and neck dilate dramatically, increasing blood flow to these areas and creating the characteristic warm, red appearance. My friend described her flushing episodes as feeling like someone had turned up the heat in her face to maximum, while the rest of her body remained normal temperature. The episodes were unpredictable, sometimes lasting just a few minutes, other times persisting for over an hour, often accompanied by profuse sweating. While the flushing itself isn't dangerous, it can be socially and professionally embarrassing. More importantly, it's an indicator that the medication is having powerful effects on your vascular system, which may not always be beneficial in all areas of your body. Number 11. Constipation, the hidden digestive disaster. Have you ever considered how a heart medication could completely disrupt your digestive system, leading to complications that can require emergency medical treatment? Amlodipine causes constipation by blocking calcium channels in the smooth muscle of your intestinal tract, slowing down the normal contractions that move food through your digestive system. This leads to prolonged transit time, allowing more water to be absorbed from your stool, making it hard, dry, and difficult to pass. I once heard about an elderly patient who developed such severe constipation from amlodipine that she required hospitalization for fecal impaction. The backup of stool had become so severe that it was affecting her ability to urinate and was causing significant abdominal pain and distension. Chronic constipation isn't just uncomfortable. It can lead to hemorrhoids, anal fissures, an increased risk of urinary tract infections, especially in elderly patients. The straining associated with severe constipation can also be dangerous for people with heart conditions, as it can cause dangerous spikes in blood pressure. Number 12. Peripheral edema, the swelling that never goes away. Did you know that the ankle swelling from amlodipine affects up to 15% of users and can become so severe that it interferes with walking and wearing normal shoes? Peripheral edema occurs because amlodipine dilates your blood vessels to lower blood pressure, but this dilation also increases vascular permeability, allowing fluid to leak from your bloodstream into the surrounding tissues. Gravity naturally pulls this excess fluid downward, which is why the swelling is most noticeable in your ankles, feet, and lower legs. My sister-in-law had to buy shoes 2 sizes larger after starting amlodipine because her feet swelled so much. She described the feeling as walking around with water balloons attached to her ankles. The swelling was worse at the end of the day and would leave deep indentations when she removed her socks or shoes. The swelling follows a clear dose-dependent pattern. At the lowest therapeutic dose of 2.5 milligrams daily, only 1.8% of patients develop swelling, but this jumps to 10.8% when the dose reaches 10 milligrams. Women experience this side effect more frequently than men, and the condition can significantly impact mobility and quality of life. The global reality. We can't ignore heart disease has no borders. It doesn't matter if you're famous, rich, or royal. Cardiovascular disease remains the leading cause of death worldwide, affecting people regardless of their social status or wealth. When I grew up in the 1960s, heart attacks were often fatal because we simply didn't have the medications and treatments available today. Remember when President Eisenhower had his heart attack in 1955? The medical world was completely different then. There were no calcium channel blockers, no ACE inhibitors, no modern cardiac interventions. So if we've made such tremendous advances in cardiac medicine, then how come we're seeing more medication-related side effects than ever before? How come patients are experiencing complications that seem almost as challenging as the original disease? Maybe it's because we've become too focused on the numbers, blood pressure readings, cholesterol levels, cardiac markers, and not focused enough on the whole person. Maybe it's because we're prescribing medications without fully educating patients about what to expect and what to watch for. The reality is that every medication is a trade-off between benefits and risks. The key is being informed enough to recognize when that balance isn't working in your favor. Take control of your health journey. You have more control than you think. Understanding these side effects doesn't mean you should stop taking your medication. It means you should be an informed partner in your healthcare decisions. Work with your doctor to find the right balance. Ask questions about alternatives. Report side effects immediately. Monitor your body's responses. Keep detailed records of any changes you experience. Take action today. Your future self will thank you for being proactive about your health rather than simply accepting whatever happens as normal aging or just part of taking medication. Remember, you are your own best advocate. No one knows your body better than you do, and no one has more invested in your health and well-being than you do. Subscribe to this channel for more life-saving health information, and share this video with anyone you know who's taking blood pressure medication. Knowledge shared is literally lives saved.